Hey everyone, it's Let's Talk Day, and I'm Dr. Sakina Rizvi, a scientist and mental health advocate at the Sommer Rotenberg Suicide and Depression Studies Program at St. Michael's Hospital.
And I'm Rob Johannes, a member of the Community Advisory Committee at the ASR Suicide and Depression Studies Program at St. Michael's Hospital.
At the ASR, we are a team of clinicians and researchers that support those in crisis and conduct research to understand the causes and prevention of suicide. My research in particular looks at the brain biology linked to suicide risk and how that can tell us about who is most at risk and potential new areas for treatment development.
I'm a musician, writer, and mental health promotion specialist with Fred Victor, and working with the folks at St. Mike's to provide and develop important mental health research and education programming for the community.
Today is a day for awareness and education, so I want to talk to you all about an aspect of suicide that isn't talked about a lot: the brain. When a person is suicidal, there may be many reasons for this. That could include psychological factors like low mood, social factors like not feeling connected to others, and biological factors. So it may surprise some that we can actually see certain brain areas that are reduced in size in those who have high suicide risk compared to those who don't, even after accounting for levels of depression. Suicidal ideation in itself is linked to changes in brain activity. And St. Mike's is home to some of the small group of scientists globally looking into this as we speak, and you can find out more about the research projects at www.asrlife.ca. The brain areas affected in those with high suicide risk are important for decision making, controlling behavior, and emotion regulation. So it's understandable that when a person is in a suicidal crisis, they don't have access to the brain resources that they usually do. Many people are familiar with the fact that depression involves a disruption in brain chemistry. This can happen in people who are suicidal as well. Chemicals important for mood, motivation, and how we experience things that are painful and rewarding can be affected. There aren't a lot of research dollars devoted to suicide, so there's still a lot more to explore about the brain and suicide.
When someone's in crisis, whether it's suicide or another emotionally intense experience, the brain isn't working under optimal conditions. We all have our limits, as do our brains. It's like getting your computer to do complex things when it doesn't have enough processing power to do them. It's system overload. You can't reason with your computer to perform faster. In the same way, if you're suicidal or know someone who is, understanding how the brain works lets us know that you or your loved one needs extra support and patience. For scientists, like the ones here in the suicide program at St. Mike's, this information can help them identify high-risk groups that need more intervention, and it can also help to develop new treatments.
Canada now has a nationwide 24/7 crisis line for suicide prevention and support. You can call 1-833-456-4566 or text 45645. Many cities also have local distress centers that have 24/7 numbers to call. So check out some other resources at suicideprevention.ca.
Remember, even though it feels horrible and it might feel like the intensity will never go away, you can choose not to hurt yourself. And yes, it's super hard, and the feelings do pass in their intensity if you pay attention.